Hello. In episode 1, Medicare Basics, we talked about what Medicare is and what Medicare is not. In this episode 2, we will begin to understand the parts of Medicare. This is very important because Medicare is not just one program. Medicare is divided into different parts. Each part has a specific role. Each part covers different services, and each part comes with different rules. Today, we will not go into details. We are only getting familiar with the structure. Think of Medicare as a system with several sections. These sections are commonly called parts. You may hear people say Part A, Part B, Part C, or Part D. These letters are not random. They help organize how Medicare works. In the next episodes, we will look at each part one at a time. This is Part A. Part A means admission or hospital stay. It is zero premium for U.S. people aged 65 and above with 40 working credits. You can check the slide slowly later if you need 2026. Updated costs like deductible or coinsurance. In terms of cost paid at hospital stay, it is not free. Part A does not support maximal out-of-pocket capping either. That's why Part A needs Medigap or an Advantage plan to control budget, right? This is Part B. Part B means blood test, OPD, doctor visit, or preventive service. In 2026, the standard monthly premium is $202.90. There is also income-related IRMA subcharge for reference. If you need updated 2026 costs like deductible or coinsurance, you can check the slide later. Part B does not have a maximal out-of-pocket cap either. That's why Part B needs Medigap or an Advantage plan to control the budget ceiling. This is Part C. Part C means a combo of Part A, B, and often Part D with extra benefits like dental or vision, etc. Part D means drug coverage. Part C is also called Medicare Advantage plans, or MA. They use maximum out-of-pocket, so-called MOOP, as a capping tool to protect original Medicare Part A and B. In 2026, the newest MOOP is $9,250. Advantage plans have competitive options in the market named as Medicare Supplemental plans or Medigaps. Both are private products to control budget ceiling. Advantage plans are optional for customers with rare health issues due to zero monthly premium. On the contrary, Medigap plans are more optional for customers with frequent health issues due to low out-of-pocket costs. Medigap needs another standalone Part D plan for drugs. However, Part D is already included inside an Advantage plan. This is Part D. First, the key point. If you already have a Medicare Advantage plan, you usually do not need to buy a separate Part D. If you are on original Medicare with a Medigap plan, you must buy a standalone Part D, and it comes with a monthly premium. That's decision point number 1. Now, costs. In 2026, the maximum Part D deductible is $615. And new in 2026, there is a maximum out-of-pocket cap of $2,100 for prescription drugs. After you reach that level, there is no additional cost sharing for covered drugs in the catastrophic phase. These are the latest numbers. Finally, one important note. For Part D, whether your medications are covered correctly depends on the specific plan and region. That part is reviewed later based on your medications. That's what you need to know. This is Medigap. Medigap is the supplemental insurance that works with original Medicare. It comes with a monthly premium, but in return, it covers the gaps, deductibles, and coinsurance, so your medical costs are more predictable. That's why Medigap is often a good choice for people who use medical care regularly. Plan G offers the most complete coverage with fewer surprises. while Plan N usually has a lower premium but includes some cost sharing under Part B. Which one fits best depends on how you use care. Thank you for your time. This episode is for educational purposes only. If you have questions about Medicare, you're welcome to reach out by email or message. No cold calls. Thank you for watching.